Hi, my name is Erin Schmidt, and I'm working with Us Together this summer as a VISTA Summer Health Associate. My role is to educate the local refugee and immigrant community about the benefits, safety, and necessity of the COVID-19 vaccine. To bring awareness, I have conducted a series of informative interviews with Us Together's clients, caseworkers, as well as health providers and leaders in the community about these issues. As an organization, we believe that widespread vaccination is essential to ending the pandemic and protecting everyone's health. We hope that these interviews can provide a greater understanding of the current struggles and provide strategies to help encourage widespread vaccination among refugees and immigrants. Mike, who is the Director of Engagement, the Director of Engagement for community development for all people located on the south side in Parsons Avenue. So thank you. I was really interested in reaching out because he has hosted two different vaccination clinics for this community. And it was really interesting because I feel that having a vaccination clinic for refugees and immigrants for our organization could be really beneficial. So I will leave it off to him. And so, yeah, Mike, could you introduce yourself and your role and just more about the communities that you serve?
Sure. Again, Mike Premo, Director of Engagement for Community Development for All People. We're based on the south side of Columbus. We're a faith-based nonprofit. We provide services from a free store, a fresh market, youth development programming, working with pregnant and new moms, as well as building affordable housing, to name but a few, on the south side. We've been around since, in some form or fashion, since 1999. And part of our work is to come alongside people in the community and help them achieve their hopes, dreams, and aspirations. We don't come in and say, this is what the community needs. We come in and say, let's work with community members to build a positive vision for the community and then assemble the assets in that community to make that vision a reality. And one of the things that we heard as we were working with folks in the community is they want to be healthy. They want to live healthier lives. They want to eat healthier. So we started like a fresh market, which gives away fresh fruits and vegetables 5 days a week. We're now one of the busiest food distribution centers in the country now. We see over 350 people a day. And we offer different programs that help people exercise, learn how to cook healthy, eat healthy. And as part of that work, we've been encouraging everyone to get vaccinated, to get the COVID-19 vaccines as soon as possible. We even went so far as to have these buttons made up to pass out to people in the community so that folks could show off that they had gotten their vaccines. And we've been working on getting folks to the vaccine centers, but we knew there were barriers in place that we wanted to help address. And so we knew the best way to help folks get access to the vaccine was to hold a vaccine clinic here in our building for people in our community. This is the South Side is a very diverse mixed income community. And we've done a lot of work to keep it as a diverse community from people of all different ethnicities, sexual orientations, income level, that sort of thing. And we want to make sure that everyone has access to the vaccine, including people who are sleeping on the street, people who are low income, people who don't have transportation. So that's part of the reason that we did this one.
Gotcha. That's great. I really like how you emphasize how, you're here to just provide these resources and not essentially, force people to be healthy, but providing the resources. And I think with the COVID vaccine, there's obviously a lot of fears and, people not wanting to take it. And I think, when you're forcing it, people aren't going to want to take it. But if you just provide the resources and the education and say, hey, we're here, I think that's really great vision. So.
And so both times that we've done it, and we have a third coming up in 3 weeks, but we literally go out on the street and just stop people as they're walking by and say, hey, have you gotten vaccinated? Come on in and you can get it right now. We are able to, part of the reason that we wanted to do this was for convenience. The location is convenient for folks to get to. They're used to getting here, but also leveraging that community trust. A lot of people haven't been to Columbus Public Health before. They've never been to the John Maloney Health Center, which is about a mile down the road, which is also where vaccines are being provided. and they're nervous about going somewhere they don't know and they don't trust. So when we open our doors, our trust in the community, they come to us for any number of services or to be part of any number of activities. So if we say that the vaccines are safe and effective and free, and you should get vaccinated as soon as possible, that holds more credibility than if the Department of Public Health is saying it or some elected official is saying it. So that's, and that was borne out both times that we've held it, is that we've been able to get people to come in because they trust us.
That's great. Are there any stories of, different interactions you've had with people who are coming to your clinics and just, appreciative and just kind of expressing that they had these concerns and that they just felt comfortable being with you guys?
We had one woman, I won't use her name, but one woman who came in who comes to church here on Sundays, and she is in her 70s and had not gotten the vaccine because she was buying into a lot of the misinformation that's out there. But when the church said to her on Sunday, come on Tuesday and get vaccinated, that was all she needed to hear. So she came in and got vaccinated. We had another woman who was terrified of needles and really just was really reluctant to get vaccinated. But once we announced we were doing it, the vaccine clinic opened at 9. She was out front at 8 a.m. to make sure that she was one of the first people there, because she somehow felt that getting it here would be less painful than if she had gone somewhere else. And when I asked her afterwards, how did it go? She said, I cried a little, but I got it done. And she was so excited that she had gotten it done. And she definitely did the one dose. She wasn't coming back a second time. So.
Well, that's really encouraging to hear. I think it gives us a lot of hope, and as we're kind of sharing in the community and trying to encourage that. So,
and the other thing too is, as people in the community who might still be hesitant see their friends and family getting vaccinated and seeing that there's no serious side effects, that there's no serious complications, they're more likely to come back the next time.
Yes, definitely. So what was the process of getting these vaccination clinics to your community, and what were the kind of logistics if other people in the community want to do that?
We reached out to Columbus Public Health, and we were provided a contact through what's called the Human Service Chamber of Franklin County, because we had made it clear from the beginning that we were telling anybody that would listen, like, we're ready to host a vaccine clinic as soon as you're ready to have one. Like, we're in. We will do whatever it takes. We have the space and we have the trust in the community. And it didn't happen right away, not because Columbus Public Health wasn't interested. They definitely were, but they were trying to get the actual real clinics off the ground. And then they were able to come to us. So once we connected, it was fairly easy. We picked a date and a time. They show up, they bring their nurses and their equipment, and we provide the space. We did the second floor of our building. We had 3 different rooms, 2 of them for shots and 1 for the 15-minute recovery period. And we also went so far as to say, you know what, we really want to encourage people to do this. So we're going to provide $10 gift cards. So we bought a bunch of Kroger gift cards that we could give out to folks. Anybody who got a shot got a gift card. And that really helped people, especially low-income people. That's a real solid incentive for folks. So, and we did 31 people the first day that we did it, and we did 36 the second day that we did it. So
that's great. Yeah. So you would probably say that incentives are a good idea. I mean, I know Columbus is doing the whole $1 million thing, but on a local level, if that vaccinations kind of locally would offer those
and just for the record, we offered the gift cards before the state announced the vaccine lottery. So we were giving out incentives before incentives were cool. So
gotcha. Well, that's really great. I guess you kind of already mentioned this a little bit, but like, how kind of more developed, how is it beneficial for communities to be vaccinated kind of in their, even a house of worship? How does that, people feel about doing that?
Well, so as more folks get vaccinated, we're able to do things more, following CDC state and local guidelines. We're able to open up to say, if we're having a meeting or a program and everybody in there is fully vaccinated, then we don't have to wear masks anymore. If you want to come shop, if you want to come into our programming and you're fully vaccinated, you're going to be able to lose the mask. So I think people are really incentivized that way, but also it really alleviates the fear that folks had. Knowing now that they're fully vaccinated, they're not as afraid as they were during COVID. And that's just a great boost to public health too, because that fear, living under that fear for a prolonged period of time, can cause health complications of its own, especially mental health complications. So that feeling of isolation, a lot of our folks come to us for programs, but they also come for that sense of community. We practice what we call radical hospitality, which is not just that the doors are open and you're welcome to come in. It's that you are an important part of our community and you have a role to play. And it's really hard to feel like you're an important part of community with a role to play when you're stuck in your house all the time. So having folks getting vaccinated, seeing things open up more and more, seeing folks come back to jobs that they had lost in the height of the pandemic. These are all great things. And so it's even more encouragement for folks to get out and get vaccinated. Because what I tell people all the time is, you thought wearing masks was bad. Imagine how bad it will be if you stopped having to wear masks and then you have to start wearing them again because not enough people got vaccinated. We had another outbreak. So that's another reason why we're just really encouraging people. But we also know that low-income people and people of color have health disparities. So if they were to get COVID, or if they did get COVID, their treatment, their prognosis would be worse than middle-class folks or upper-class folks or white people. It's a real problem in our society that if you get sick and you go to the local hospital, if it's overloaded, that's going to be a problem. Are you going to have access to the kind of care that will really help you fully recover? And then what long-term effects are there afterwards? I mean, a lot of our folks are dealing with asthma and breathing-related issues anyway, because of growing up in low-income and poverty-ridden areas. COVID would just make that worse. So helping folks understand that by getting vaccinated, you're actually not just saving yourself, which is really important, and preventing that adverse health outcomes, but also helping your family, your kids, your community.
Yeah, definitely. I like how you point out about the different disparities, because we're working with refugees and immigrants, and especially refugees and immigrants too, but there's a huge language barrier. And so it's really hard. We obviously, don't want people to get sick, but when people get sick, there's a lot of just misinformation and them trying to get help. And so, just everyone getting vaccinated and just healthier is definitely our aim. So. Is there anything else you'd like to share about how the city or other organizations can help erase these barriers or fears, or just helping people to get that vaccine?
Well, I think it's twofold. The government institutions, and we've been very fortunate. We have a great partnership with city leadership and Columbus Public Health. But in general, government entities focused on public health have to be listening to the organizations and the individuals on the ground. Speaking of health disparity, there goes an ambulance. So they have to be listening to the folks on the ground to identify systemic barriers to access to healthcare. And the organizations on the ground have to be advocating for their community, to communicate and to leverage their relationships with their elected officials or the government organizations to say, this is what our community is experiencing, and here's what we think you can be doing to help that. So it's a two-way street. Government entities need to be communicating with the folks on the ground, but the folks on the ground definitely need to be banging on the doors of the government leaders and saying, this is what our community wants, this is what our community expects, this is what our community deserves.
Yeah. Are there different ways that these communities can reach out to government officials, or kind of what would you suggest if, leaders of the communities, kind of like yourself, beyond getting vaccinated, but wanting to bring up these issues, what do you think is the best way?
Well, for anything that we do, it's all about building relationships of mutuality, meaning you're not helping me, I'm not helping you. We're coming alongside each other and going through life. And that's true of any organization or elected official too. If the first time you're calling up your elected official is when there's a problem or when you're asking for something, that's going to make it hard. But if you've built a relationship over years where they've come to visit you, many of our elected officials have been on the ground here on the South Side. They've toured our facilities. They've met our community members. So when we call, they're willing to listen to us because they know that we're that we're doing the work and that we're doing it well, and that we have the community's back and the community's trust. So they know that. I'd go so far as to say they know that there's a downside to not taking our call, right? Mm-hmm. So what you want to do is convince the elected officials that there's an upside to taking the call and there's a downside to not taking the call. But by building relationships, you don't have to threaten or cajole or harass. You can just, you're calling up your friend, you're calling up your fellow community member. That's why we've had such great success. And we weren't the first nonprofit in Columbus to do the vaccine clinic in its facilities, but we were one of the first. And we want to really encourage, this is a great thing that any organization can do. It was minimal staff impact, minimal time commitment on our part. You just literally have to have the space to do it. And it was a great experience, and we've done it twice. We're going to keep going as long as we feel it's required. And it's a byproduct of the relationship that we've built with Columbus Public Health over the years.
Gotcha. Well, that's wonderful. Thank you so much for sharing. I know this is going to be really beneficial for some communities. And
great. I'm happy to share.
Yeah. Well, thank you so much for your time. Again, yeah, I'm just so grateful to talk to you and just learn more, and how we can all get together and get vaccinated and just get back on track. So
great. Thanks. Nice talking to you.